Testosterone is finally being talked about. Thank God. Testosterone for women, that is. So if you struggle at all with fatigue, self-esteem, executive functioning like decision-making, brain fog, libido, energy, it could be low testosterone. There's 2 studies that recently came out discussing testosterone replacement therapy for women and sexual function. Both of them had significant improvements in libido, arousal, orgasm, pleasure, self-esteem, significant statistical improvements. Now they're a little bit different, and I want to discuss those and then laugh about it a little bit. So the largest study is actually a review of multiple studies where they look at multiple studies that have been done over time. So this one had over 3,000 people in it, and they were talking about a testosterone dose of, they say, 300 micrograms per day. Now, how did they get that? Well, they used a man's gel called androgel, which comes in 50 milligram packets, and they approximated 300 micrograms out of that. Now, it's interesting in the study, what they say is the woman would take 1/10 of an androgel prescription. Well, how do you divide a tiny little packet into 10 servings? Good luck. Besides that, 1/10 is not 300 micrograms, it's 500 micrograms. So here they are reporting on a 300 microgram dose where 300 micrograms is 6% of 50 and not 10%. So that's actually like 1/12. So that makes it even harder to divide a tiny little package into 12 servings. But it is what they call regulated medication, meaning the FDA has approved it for use in men, and it's being used off-label for women because you know what? There is no women's dose in FDA-approved forms. That is a different topic, but it should make you mad, and hopefully that will change over time. So the second study was much smaller, but it showed very similar benefits. They were using compounded testosterone from a compounding pharmacy, which is much easier to get the right amount because they take testosterone and dilute it, and they'll make it in whatever concentration you want. And typically, in my practice at least, the woman will use between 1/4 of a milliliter and 1 milliliter. And so they give them syringes that they can apply, or a toppy click, which dispenses 1/4 of a mil per click. So this second one, they said most of the women were using 2 milligrams daily, which just seems like a higher dose, but they checked levels in these women and they weren't sky high. And so maybe that is the right dose. I don't recall seeing what the levels were, what the average testosterone serum level was for the much larger study. It may have been hard to find because they were looking at compiling so many different studies together. Now, I was looking this up in a traditional medicine AI platform called Open Evidence, which gives you access as a provider to multiple different scientific journals in order to try to keep up to date on science. And this is what made me laugh a little bit. When Open Evidence found these 2 studies for me, well, actually, it didn't find the second study initially. I had to ask for it because I had heard that it was out. It actually only gave me the one that was the large study. And I said, wasn't there another one that just came out in a different journal? And said, here's what it said. Yes, but it uses compounded, non-regulated medications. The other study is much superior because it used FDA-approved medication. Yeah. At a freaky dose that how do you measure because it's 1/12 of a package. So I'm just laughing at this because it illustrates the massive bias in the modern medicine, in the traditional circles against compounding pharmacies. And I think it's completely unfounded. You know, 150 years ago, that's the only way we would get medication is from a compounding pharmacist. And then Big Pharma came out and drove all the small pharmacies out of business. But when you're looking for finesse and customizable doses. And for testosterone, I would say, because you don't want to try to use 1/12 of a package, I think it's an excellent alternative. Now, I did check the ingredients in Androderm, and it doesn't appear to have anything toxic in it, but a lot of these traditional pharmacy creams have fragrance or coloring or parabens, which is a toxin. And I don't like to combine toxins with my medications if at all possible. So you need to work with a provider that has a good compounding pharmacy if you're going to do that. And we vet all of our pharmacies, and we've talked to the pharmacists at them. We make sure that they, double check their work, that they have, checks and balances. They're what's called PCCA certified. There's possibly some fly-by-night pharmacies out there that maybe have some funky outcomes because they're not as careful. But I don't think that we should throw the baby out with the bathwater and say just because a few compounding pharmacies aren't as good that we say don't use any compounding pharmacy. So there you have it. The good news is there's evidence that testosterone is helpful across many areas of sexual function, not just libido. So if you're struggling, get checked. Ask your doctor to check your level. And then make sure that they know what optimum is and not just normal range, because there's a huge difference. If your doctor refuses to check your level, you can get it checked from these other lab companies that allow you to request testing on yourself and pay for it, or get a different doctor. There's an idea, someone who's willing to listen to you. I'm Dr. Yvonne Karney. I'm the Hormone Locksmith. If this is helpful to you, please pass it on. And if you are wondering if you might have symptoms of low testosterone, take my hormone quiz. The link is here, and it gives you a very detailed summary of any hormone imbalance symptoms that you might have. We'll see you next time.